Emergency responders are in Pueblo tonight for a symposium on trauma care. And after 2 mass shootings last year in Colorado Springs alone, that training has a new sense of urgency. KRDO News Channel 13's Katie Spencer is live at St. Mary Corwin Medical Center tonight, learning more about what took place. Katie?
Yeah, that's right, Greg. Most of the traumatic injuries that come here to St. Mary Corwin have to do with falls. But with the changing world around us, medical professionals are preparing for a new kind of trauma, the kind that comes with mass shootings. When accidents happen, medical professionals need to work like a well-oiled machine.
When we think about trauma, we think about people who fall from great heights or gunshot wounds, perhaps.
300 doctors, nurses, and paramedics gathered at the Wills Trauma Symposium in Pueblo Saturday to make sure those responses are precise and efficient.
The faster we get to a trauma patient and are able to figure out all the injuries that are involved in the traumatic event that's occurred, the better their outcome is.
The majority of trauma calls St. Mary Corwin receives is because of falls. But Dr. Ed Rocht says the world of trauma is changing.
U.S.-based trauma has historically been motor vehicle crash. There's been, of course, the violence associated with it, but organized, large-scale violence is relatively new.
And events like the Planned Parenthood shooting are forcing them to expand the scope of their training.
So we learned from the Colorado Springs shooting. We learned from the San Bernardino shooting. We learned from our military colleagues.
Turning tragic events into a powerful learning tool.
This is how we can do things better. It's a very, very important part of medicine.
Because of the money that was raised at last year's trauma symposium, St. Mary Corwin was able to buy a simulation dummy which medical professionals can practice with. Reporting live in Pueblo, Katie Spencer, KRDO News Channel 13.